Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. Welcome back to Direct Primary Benefits Podcast. This is your host, Brett Shoemaker, and we are live with episode 7 here. And I have got an awesome lady that we're going to be hearing from today by the name of Shielvonda Haith coming to us. Shielvonda, where are you at today? I know you're a pace setter normally in Austin and from Atlanta. Where are you tuning in from today?
So we are in sunny Austin today.
Sunny Austin. I love it. So Shielvonda, we actually met at the Free to Care conference, and I'm so grateful that Mr. David Balot introduced us. So why don't you tell everybody a little bit about you personally and how you got into this crazy world of healthcare?
Okay. Well, I am a wife. I'm a mama too, and I have been in healthcare, I would say, the majority of my career, so about 14 years, almost 15 years now. And the funny story about me coming into healthcare is that I went to college, like many people, to be pre-med. So I wanted to be a doctor. I always wanted to help people. And let's just say after the first year, I quickly understood that was just not for me. Love doctors, but just the amount of studying and 20 years old, I was like, no, not for me. But I always had a love for healthcare, always wanted to do something impactful, and so had the opportunity to start in public health research and epidemiology, and that's kind of how I started coming into kind of the field.
I love it. So Shielvonda is a mother and wife, as she mentioned, and she's raising some athletes. So I don't know if you want to talk about that real quick, Shielvonda. You got some athletes. We had a great conversation about sports and kids and learning what sports they won and all that good stuff. How's the progression of that looking like?
So it continues with my 22-month-old and his really odd love for football, even though we try to keep exposure to football at a minimum. He really is actually still gravitating towards holding the mini football with perfect for. He also just recently, I heard, was watching wrestling and started tackling teddy bears at his grandparents. So we have what seems to be a young athlete of something, and then of course I have a 6.5-year-old, and my daughter just enjoys art and just running and soccer and yoga. She really loves yoga. So we don't know what the future is going to be for them, but they both are very active and love running around. And that 22-month-old and that football, I'm just not sure about.
Yeah, all those scary head injuries we hear about on TV and all of that. Yeah, it can be a little nerve-wracking as a parent sometimes, I'm sure. But so let's talk, Shielvonda. You have quite the resume. You've been in healthcare now. You said what? How many years was it? Did you say 14?
Yep. So I started out in epidemiology and public health back in 2007, and I then went to grad school to pursue my master's in healthcare administration, and from there started with my very first startup in the healthcare space, and have been working in healthcare since.
So your first healthcare, tell me a little bit about that, because you worked for, I guess, what later became Paladina and then Everside Health. So talk to me a little bit about what you did there and how that kind of introduced you into the whole direct primary care model.
Yeah, so kind of take a step back. I came out of a healthcare administration program where the majority of my classmates went into kind of the hospital setting or the clinic setting. And I knew that I wanted to do something different. And so I got the opportunity to work at that time for a startup called Modern Med. It was a few years old at that time, and they were really working with provider practices. So very specifically private practices, independently owned. And they were converting those practices from a traditional style way of delivering medicine to more of a concierge style way. And so I had the chance to go work with them, and my first role was really supporting the providers themselves in transitioning the practice to the new model, right? 500, and really thinking about, instead of 10-minute visits, really concentrating on the patient themselves and what they need. And so moving away from kind of that time-driven aspect of delivering care to more of a very specific, customized, kind of patient-centric way of delivering care. So started out working with independent private practices that way, and then we began moving into the employer space. So we started working directly with self-funded employers that noticed that healthcare costs were rising for them, and so they wanted to change things and do something different to contain that cost, but not compromise on the benefits or the care that they were delivering to their employees and their families. So we started working with a few specific employers in certain regions of the country at that time, and we were bringing that concierge style type of delivery to the employer themselves. So we built on-site clinics, then we built near-site clinics, and then we actually had very specific doctors that were matched with those employers, and then they served those employers, the employees, and they served the families of those employees very specifically. And that's how we came into then the direct primary care space.
That is beautiful. So let me ask you this. You were talking about geographically, you guys were kind of focused. What area of the country was that kind of demographic in?
Yeah, so we started out, so the first employers that I started working with were actually in kind of like the Midwest area, so kind of the Wisconsin area. And then we started finding that there were other employers throughout the country that were interested. So I worked with employers in, Los Angeles, California, worked with employers in Arizona, in Utah, South Carolina. So it started to actually be throughout the country after we started with those first few. So we grew really quickly as we migrated to the employer-based space.
Gotcha. Now, let me ask you a question because I'm curious about this. So you have I can't remember the exact name of the company. I've got it in my bag right here as we speak. But I've noticed that Wisconsin is a very innovative state when it comes to healthcare and some of these changes that have happened. And I know I'm trying to remember, I'm pulling it out of my bag as we speak, as I mentioned, but there was a company called, I think it's Seriograph or something like that. A whole book was written on how they fixed healthcare. It was the company that solved healthcare, John Tornes. Is there a reason why Wisconsin is such the innovators? I know they have, the Amish have always been big into kind of like the whole health share, needs sharing kind of concept. Is that why, or maybe you can shed some light on that, or?
So I'll kind of give my version of why I think they were a very good place for this model and why they were kind of trailblazers in it. My take on it with my experience there with the employers that we worked with is that I think that the structure of the companies was such that many of the CEOs, many of the owners of the larger companies saw their employee base as family. Many of the employees had worked for the companies for years and years, if not decades. And for some companies, they were coming into generations of having worked there. So, and this wasn't just small companies, right? It was some of the larger companies, too. They just had a very family feel to the way that they ran their business and the way that they worked with their employees. And I think because of that, when it came time to want to do something different in healthcare, because ultimately they were working on cost containment too, right? So let's be honest about that. It was a business decision to do something different to help contain the cost. But I think in their decision, they didn't want to just cut benefits. They didn't want to just do the easy thing. I think they wanted to do the right thing because they saw their employees and they saw the employees' dependents as their family and their friends. So when they made the decision to adopt direct primary care and those styles and those models, I think it was because they just saw their employees very different.
Gotcha. So basically the culture of the company in that area was more of like, hey, this is a friendly family environment and we want to take care of our people and make sure that they're taken care of. And obviously contain the cost as much as we can to make it make sense. But they really cared, I guess, is what I'm hearing.
Yes, exactly.
Beautiful. So when you look at that experience there, so you were with, I guess, it wasn't Paladina at that time. What was the name of the company at that time?
So I started out with Modern Med, and then we were acquired by Paladina a year after I started. So I started in 2011, and we were acquired January 2012.
Gotcha. And then later on, I guess Everside stepped in and bought Paladina. I guess that happened. I don't remember exactly when that was, but that wasn't too long ago, right?
Right. That happened a few years ago, about 2 years ago or so.
Gotcha. And so you actually learned so much in there. Before we move on to a different topic here, I want to ask you, so what did you see was when you were working with these employer groups, what were some of their apprehensions of either I guess, were they in the self-funded model usually already, or a lot of times were they moving to the self-funded? What did that look like?
Yeah, the majority of them were self-funded, and they were working with their brokers to come up with solutions. And so we came up as, a solution that was of interest. But most of them are self-funded employers.
Okay, so most of them were already self-funded. So what were some of the apprehensions? Did they have any apprehension to the direct primary care model, or did they have so much trust in their broker that at that time when they were kind of being posed the proposition of direct primary care, they were just excited about it? What was their temperature like?
So there were natural apprehensions for sure. So they were naturally apprehensive and cautious. So some of the things that created that feeling were, of course, it's something new, right? It's a big decision to change healthcare and make a change to benefits in any company. And so I think that, the leadership for almost all companies wanted to make sure that things were done the right way and that they were done, very methodically, right? Because they wanted to have as little disruption as possible for their employees, and they also want to make sure employees understand. So there's always kind of like apprehension around just the process and the change itself, and how do we encourage adoption, right? I think some of the other apprehension points were around providers. So with the DPC model and the employer-based structure, we are going out and we're recruiting the providers and doing kind of like a matching process, right? So we may find 20 providers that are interested in working with a particular employer, and we allow the employer to very much be active and involved in that interview process. To not just vet the provider outside of us, but to find the right personality match for that company and for their employees, right? And so that was a really important aspect of the way that we did business, because one of the apprehension points is we're telling our employees that you maybe will no longer see that doctor that you've been seeing for the last 10 years. You're going to be seeing a different doctor, and so that's a disruption, right? And if you've built that relationship with that doc for 10, 15 years, why I don't want to change my doc. Why am I changing my doc, right? Why is this doc better? I want to keep going to my same one. And so that was a big apprehension point as well, is how are we going to encourage the employees to take a chance on these doctors that they don't know and abandon that position that they've grown up with, right? So that was a big concern.
Gotcha. Now, whenever they made the transition and they finally experienced the care that the direct primary care doctors provided, what was the feedback, and what was some of the things that you got in terms of like the employees, like, oh my gosh, I cannot believe this is way better, right? Because so many people, they think that they have this relationship and they don't want to leave this doctor, but what they're not realizing, a lot of times the reason that they have this doctor, and I don't know about you, but I've seen so many times that when people don't want to leave their doctor, they don't even have a PCP. It's not even their primary care physician. That's what PCP is, in case anybody's wondering. But they're usually talking about a specialist, because those specialists have more time, have smaller patient panels. And so when they start to experience a PCP operating as a PCP, which in my opinion, the only way a PCP can operate as a PCP is in the direct primary care model. People are blown away. I know I was blown away. So what was some of the feedback that you got from employees when they actually got to see the services rendered by the direct primary care doctors?
Yeah, I think you just hit the nail on the head, is the realization that the relationships that they thought they actually had, they didn't actually have at all. So, things like being able to call the doc for a medication refill without being required to go in and see them because the doc knows them, right? Knows their medical history intimately enough to be able to call in that prescription without seeing them, right? So really small things like that were a big one. Things like, you have, a problem in the middle of the night and you're trying to decide whether you should go to the hospital or whether you should kind of wait till the morning, right? And being able to call up the doctor directly, not reach the answering service, but reach the doctor and having them listen to you, having them say, okay, here's the advice, and then having them call you back in an hour to check on you and see how you're doing, right? I think there were things like that the employees and their families realized was that this was creating a real patient-physician relationship that didn't exist before, and really seeing what that looks like, and how that also, prevented issues down the road, because you actually do have a doctor that's going to call you and say, hey, Brett, you have not come for your annual. Let's find a time that's going to work for you. And they're calling you and reaching out to you rather than waiting on you to remember to do it. They're asking about your kids, right? How's your daughter that I saw a month ago? How's her, if they did a sports physical, remembering the sport that child plays, and then asking the parent about it because they know that's important, right? And so I think it was just ultimately realizing what a true patient-physician relationship really looks like in practice versus what we're conditioned to think it is.
I know, it's just an amazing thing, right? I love those words, the direct patient-doctor relationship. Those are just like music. Those words are just music to my ear. I just love it. So let's switch gears now, because you had these experiences and you even were in a part of a dental insurance company. So I don't know if you want to talk about that, but that transitioned you, gave you a ton of background and information, and really the foresight to say, you know what? There's something missing out there, and that something missing is being resolved through this awesome company and this startup that you guys are building, which I'm excited to hear all about, which is called BrightPay. So let's talk about BrightPay and what you guys are actually delivering. Talk to everybody out there as to what they have to look forward to, what exists today, and how they can be a part of it.
Yeah. So we're very excited about what we're creating at BrightPay. We came out of, both my co-founder and myself came out of the healthcare industry, and more recently I worked for the dental plan side, so was able to kind of really see all of the kind of work that goes in behind the scenes in the kitchen, so we speak, as it relates to plans and, the construction of those schedule of benefits and code details and what's covered, what's not, co-insurance, co-payments, like all of the nitty-gritty details that go into kind of that plan design piece of it and rolling it out. And so so I went from kind of that space to launching BrightPay. And we're so excited about BrightPay because, quite frankly, one of our goals that we set out to achieve is to truly create a place and a space that providers and patients can both benefit from. As a patient who's quite knowledgeable in the healthcare industry, my personal experience a year ago was simply, in short, had a major healthcare decision that I needed to make for my daughter. I had a very short period of time to make that decision. And after going through a lot of questions about what's covered, what's not covered, trying to get estimates around it, what we found was that we got, one amount of $3,000-$4,000 estimate, and day of service when you're ready, right? Like my daughter was going in, she was being put under, she's going to have the procedure, and then we're told it's going to be $7,000 out of pocket patient responsibility, and that's really important because we always think that these really crazy medical bills come from people that are not insured. And it's really important to understand that there are people that are fully insured and insured very well, maybe overinsured in some aspects, that still get these really crazy deals that they don't expect. And so anyway, so as a patient, we experienced that firsthand and wanted to come up with a solution that would benefit both providers and patients the same. So we launched this platform that helps providers actually develop cost estimates for their patients, right? And this is across different specialties. It helps them be able to say, here's at a very, very granular code level, all of the things that we're going to do for this particular visit or this particular treatment. Here's the number of each item that you're going to need, and here's how much it's going to cost you. And really giving the patient kind of that itemized piece, and then totaling that up and saying, here you go. And we deliver that, so we allow the providers to do that pretty quickly and easily. And then it delivers to the patient in a digital format. So the patient receives this estimate, they can see very clearly what's expected, what their responsibility is, what their out-of-pocket portion is going to be, and then they can take a next actual step. So they can go from seeing it to being able to financially plan and own that part of the process. And that's where we saw the gap, right? Is that even if you were able to get an estimate and clarity around what things are going to cost you, how do you take that information and as a patient really own the planning part of it? So we're building, a platform that's really going to support patients really in that entire process, navigating the system from beginning to end, right? So now you can plan for the care that you need, right? So understand what you need, plan for it, and then being able to pay for it.
I love it. I love it. So we actually interviewed Savos, and I connected you guys as well. And Savos helps more on the elective surgery side. So just to be clear for all of our listeners that may have listened to that episode as well, what you guys are doing is, somewhat similar, right? Because you're connecting the consumer and the patient, or the consumer and the patient rather, with the provider and getting those transparent cost estimates and the kind of the scope of services, if you will, that are going to be pertaining to this is, I know you mentioned chiropractic, you mentioned physical therapy. What are some other things that are going to be like popular applications for BrightPay?
Yeah. So pretty much if you think about it, you have your specialists, you have your primary care. So when we think about specialists, aside from those mentioned, OBGYNs are a great segment for us as well because so much of what services that they may offer can be covered in part by insurance, and then there's certainly parts that aren't covered, and that can lead to a lot of out-of-pocket expenses there. So that's really a very attractive segment for us as well. We're behavioral health, substance abuse, inpatient facility treatments that cater to that sector are also really attractive for us as well for kind of similar reasons. Pain management, integrative medicine. So those are some of the areas that are particularly attractive for us that we've gained some foothold in as well. And we continue to move into other specialties as also. So eventually we'll move into like the dental space, ophthalmology, optometry in those areas.
Wow, that is awesome. I love that. So let me ask you this. So will they have a portal where it kind of plugs in, like maybe their employer group will say, okay, hey, this is the plan. This is what the plan covers. That way you give them not only what the transparent prices are, but they know what their plan covers. Will there be a utility that would be able to link what their plan covers specifically, or will it just be kind of like a marketplace Rolodex of information?
Yeah, great question. So as of today, the way that it's built, we do actually we do have a portal. So we have a provider side and a patient side. And our patients, once they create that account, one of the great things about it is they can run their own eligibility just like a practice would. And they can see, their coverage details. So they can see, deductible, they can see total amount deductible comparative to what they have remaining. They can see what's covered. So some of those benefit details, like if they've got chiropractic coverage, great. What does that cover? Does that cover my labs from a chiro? Does that cover my x-rays? Does that cover adjustments? So the patients will gain access to that level of detail as well. So they can see that. So whether you're on Aetna or UHC or whatever plan you're on, or if it's a custom plan from any type of alternative models. We can also create those and load those in our system. So, but the patient gets full insight into exactly what their benefits are going to be and what's covered.
So it's almost like a kind of like a online, or I should say like a digital healthcare budgeting tool, almost like you would use like like the Dave Ramsey app or all those different apps that are out there where you can kind of plan and budget. This is their healthcare version to be able to plan and budget expenditures for procedures or providers or what have you, and have it all in one place.
Yes, I love that analogy, Brett. Yes, absolutely. So where we're going with this is we want to create that entire experience. If you think about 401k platforms, right? You can plan for it in scenario build, and then you can kind of manage, that day to day, whatever plan you choose, right? And so we're actually leaning towards exactly that, right? We want that tool for healthcare, so you can not only pay for what you have to do today, but you can think about very intentional, what may I have to do in the future, whether that's family planning because I want a little one and I want to make sure that I know it's gonna cost me in 2 years, so I can start saving for that and planning for that, or whether I'm 50 and I know at some point I'm gonna have some type of knee replacement surgery or a hip replacement surgery, and I want to plan for that, right? But ultimately, that's exactly where we're going, is being that trusted source of a planning tool and a financial management tool for patients' healthcare.
Absolutely. I absolutely love it. I can't wait to use it. So let me ask you this. So right now, you can go and visit the website at brightpay.org. Of course, you can reach out to Shielvonda on LinkedIn. But Shielvonda, if somebody wanted to go online right now and kind of play with the tool and see how it works and things like that, how can they start doing that? Because I actually myself am like, hey, I need to download this or go to the website and check it out myself. So tell me how we would start doing that.
Yep. So as a patient, if you are interested in checking out the tool, you can always visit our link. We have it's brightpaypatient.me, and you can create an account, and then you can kind of start using it. And so if your doc is not on the platform currently, then what you'll gain access to is kind of the baseline portion of the tool, and then you can give us your doc's information, and then we're happy to reach out and then see if they'd like to join the tool, and then that way you'll be able to get that transparency. Otherwise, you can check your eligibility. If you have insurance, you can kind of go through that part of the process. And they can also, of course, visit our website. If you're a provider, you can visit our website at brightpay.org and schedule a demo, and we're happy to walk through a demo with you.
Okay, perfect. So brightpaypatient.me, I'm there right now. And so I'm going to go to this, click on this little box that says, welcome to BrightPay BP patient registration. Is that where I go?
Yep.
Okay, sweet. Well, I am going to do that. So Shielvonda, before we close out, I want to ask you, what do you see as where healthcare is going, and what do you think is going to take place over the next 1, 2, 3 years? What is your vision for the future before we let you go?
Wow. Well, I do think healthcare is changing, and it's changing much more rapidly, and it's going to change much more rapidly in the next 2 years than it has probably changed in the last 10 years. I think there's so many things coming out of COVID and so many lessons learned have taken the industry into a level of being open to innovation in a way that maybe it hasn't been before. So I think we're going to see a lot of new startups. I think we're going to see a lot of innovation, and we're going to see some quick adoption for the right types of companies and the right types of tools. I also think that we're going to lean really heavily towards I know people are going to not like this, but I think that as we get to 3, 4, 5 years from now, I think we're going to start to see an industry that is going to become more and more patient-driven. And I'm excited about that, because right now we're in a place where patients are starting to get more autonomy, but I think we're moving towards increasing that. And I'm looking forward to that. I'm excited to see patients be able to own their relationship with their doctors more. I'm excited to see patients be able to be more engaged with the process of healthcare, whether that's making clinical decisions about which treatment plans they choose, or being more active in which doctors they see and first and second and third opinions, or whether that's driving the financial part be more involved in the process, and I think that we're moving in a direction where they're going to own more and more and more of that.
Absolutely. I couldn't agree more. And I am excited for the journey. And so I don't even think I've told you about this yet, but I want to just remind all of our listeners, like we did in episode 6, that we have started a little bit of a Facebook group called the Healthcare Mastermind Group. And so I'm going to invite you, Shielvonda, to that. I think you're on Facebook, right? Yeah, I'm going to invite you in there because I definitely want to add you into the conversation. So hopefully we can grow that network and just let patients know, just be an advocate for all of the cool creative things like BrightPay that are coming, that are here, and that are already available for use today. So thank you so much for making the time to get on the podcast today, Shielvonda. I'm excited about BrightPay and all the things that you guys are doing, and can't wait to see the progressions as we go. So thank you so much for joining us today, and I look forward to conversations in the future.
Yes, absolutely. Thanks, Brett, for having me.
Absolutely. Well, guys, you have heard it from Shielvonda Haith today with brightpay.org. Thank you so much for listening. And I just want to encourage everybody out there. This is episode 7. We've got so many more episodes in the pipeline. Make sure that you subscribe. Make sure that you follow us. Give us a review and rating if you got some value out of today's episode. But make sure you tune in because we are on a mission, and that mission is to fix healthcare. So this is Brett Shoemaker, your host, Direct Primary Benefits Podcast. Have a great day and God bless.